masks and other restrictions?
Well, as we said, we would always tailor the restrictions to the circumstances that we face ourselves with. And 2 weeks ago, with discussions with the Commonwealth Chief Health Officer, our COVID and Economic Recovery Committee met, and we made what I see as modest and appropriate changes over the summer break, with going back to 1 per 2 square metres for density limits. That's a very modest change. We're asking for face masks to be required over the summer period of time, and just also asking people to reduce mingling where they can. We think these are very appropriate settings for the circumstances that we find ourselves in. As we have said every day, in every press conference, myself alongside the Health Minister, if the facts change, the response changes. The circumstances change, we'll tailor our settings. If we need to tailor or target settings in certain areas, we will adapt those settings to suit the circumstance. But let's all be reassured right across our state. We are doing incredibly well. We have got through the last 2 years and we're going to get through this period. So, I saw the Shadow Health Minister out yesterday saying the New South Wales health system was at breaking point. Well, how utterly irresponsible. We don't need to be instilling fear in the community, but hope and optimism. And our health system is the strongest in the nation. It is not at breaking point. Comments like that from New South Wales Labor are irresponsible and reckless, and immature in circumstances of the situation that we're facing today. Our health system remains incredibly strong. We're seeing other states close their borders around the country because they don't have faith in their health system. It's great to be here in Wagga Wagga to meet and thank many of the doctors and nurses, our frontline staff, who are doing an outstanding and amazing job in keeping people safe. Our focus is keeping people safe, learning to live alongside the virus. We'll tailor those settings as we move along, and we believe the settings we have in place strike the appropriate balance as we move through this next phase.
Speaking of the health system, more than 800 COVID-positive people were incorrectly told that they were negative. How worried are you about the knock-on effect of those people on case numbers?
Well, there'll be 800 cases that will be adjusted to those figures. My understanding, and still getting the advice from New South Wales Health, who are dealing with the pathology company, but my understanding is that those case numbers may have already been included in the case numbers that New South Wales Health has announced. What's important is mistakes like that from the pathologists don't occur again. What's the good news is it was picked up, and those people who were given that incorrect information have now been informed, and I know that New South Wales Health have been in contact and made it very clear that errors like that are unacceptable, and the understanding is that there are measures in place to ensure that that doesn't occur again, but ultimately as well what it also shows, the checks and balances are in place to pick up when those errors occur.